organizations and associations here on Down to Speak, I will not waste more time, but to invite the private sector representative, Mr. Kenny Green, please.
Good afternoon, everyone. Firstly, this is a timely and well-needed intervention into the debate on the preparation for an instance or the instance of COVID-19 on our economy. The DAIC, whom I represent, currently undergoing a survey with our membership. We expect the results back next Wednesday, and the survey will look at the impact on the business, on the projections, on supply chain, and also the adherence to the precautions that are floating in the public domain and also communicated by the Ministry of Health. The precautions for the private sector are the same as for the general public. Creation of safer spaces in terms of safe distance, ensuring better hygiene within the workplace, monitoring and reporting of unusual health instances, and ensuring that where possible people can work remotely, usually from home. We have an excellent fiber to the home infrastructure from both the telecom providers. This may be an opportunity for some of our businesses and indeed for the way we communicate with each other. We travel across this region as businesses and sometimes have meetings even locally where we could actually communicate online and do so safely and inexpensively. So that is something that we must take note. The other factors that we have to look at, there are, of course, going to be bigger challenges even after COVID-19. So, because this won't last forever, I think we have to be very positive in that, we've had pandemics before, and nations, people get through these instances, and having survived as a collective Hurricane Maria, we know what it's like to go through trauma and to come out of it. So we want to come out of it without the trauma, obviously, but the private sector has to be able to provide data and to share data with government. And I would like government to be on board with even the procurement strategy for filling the gaps for needs for government with the local private sector, because it will mitigate against any economic shocks that we may have. At the same time, I think we need to look at providing more data. I'd like to salute and commend Mathan Walter, Director of Trade, for some of the work that he's done in compiling statistics of the supplies that the local private sector has and the country has in order to guarantee food security. For the private sector right now, we have to look at the projections going forward. 2 weeks ago, we had the governor of the central bank of the ECCB, Mr. Antoine, and he projected growth figures which now in context will not likely be met. The world is facing a collective GDP downturn by about 3.2%. And that is going to be huge for many of these economies like ours which are trying to move forward. We are going to actually have to look at more collaboration with government. The Prime Minister alluded to, and I was hoping to hear from the Banking Association, how they planned to make some of that liquidity available. It is going to be something that we will revisit, and if we have to do it in concert with the government and the bankers, then so be it, but it needs to happen. There is a bright spot in all of this. 6 weeks ago, the repercussions of the supply chain shortfalls were much worse than they are now, simply because the timing of events has meant that China is coming back online, and they are the primary supply chain engine for the world trade. And so therefore, some of the gaps that we would be having for some of our businesses, even in getting supplies and things in, will not be as bad as they would have been 6 weeks ago. That doesn't mean things are going to be hunky-dory, but it will be better. The other thing, obviously, is the preservation of the relationship between the workers and, employers. I was heartened to hear both the presentations by DEF and also the DHT and the Social Security. But that constant dialogue about, basically what employers will need to do to make sure that we guarantee the businesses, the preservation of our businesses, yet at the same time give some level of consideration for the safety and the health of the people who work for us. That is going to be critical. In summary, we have a session next week, Thursday, at Prevo Cinema Hall, the DAIC, where we'll have a general meeting for members and other businesses to talk about the way forward, and Nikima John Baptiste Royer will be making a presentation on effectively handling disaster and crisis situations. And we encourage businesses to attend this. We will provide data to the government, and we would like to encourage the government to continue to provide as much information, because even in this climate where you would think that we are all sensitized to the need to be together in a disaster, there are so many different types of competing channels of information that we need to secure and make sure that we are all speaking from the same hymn sheet on the things that are most critical for us to be able to move forward. Thank you.
Thank you, Mr. Green. I now invite Mrs. Rosie Felix of the DPSU, please. Oh, I see the Hefe there, and that's Mr. Later. So I guess between them they will decide.
Thank you very much, Honorable Prime Minister. Good afternoon to everyone. As it's on. All right. I am saying that as a legal constituted representative body for public officers who will invariably be on the status of the situation in Dominica. The receipt of such information should never be determined by the whims and fancies of those authorized to disseminate the information. We also firmly believe that the union should have been involved in discussions relating to the disease at a much earlier date. Our members are the ones who are exposed to provide health care to the patients. These include medical doctors, nursing personnel, ward aides, laboratory workers, and radiologists, among others. At our ports of entry, officers and other public officers are among the first exposed, have to handle personal items and to be in contact with all persons using these facilities. The proposal to confine health professionals for prolonged periods to isolation centers for purposes of managing the spread of the disease presents issues of industrial or employment interest and concerns to the union. Having health personnel assigned to these isolation areas for patients implies a change to their normal working conditions that is yet to be negotiated with the union. Such a requirement cannot be viewed or considered part of their normal day-to-day activities or duties. This change calls for working terms and conditions well outside established periods of employment. It will require such officers to be away from their families and loved ones for possibly several weeks at one time. Think of the inconvenience to them and of the mental stress not only to themselves but to members of their families. including innocent children and possibly elderly and almost helpless persons. Even upon returning home from quarantine, think of how they will be viewed by their families. Such drastic and unprecedented changes to the terms and conditions of their work have to be negotiated and agreed in advance in the interest of fairness and natural justice. Again, while we appreciate being invited to this forum, we strongly hold the position that we should have been invited to a special meeting to discuss our concerns and more specifically to the proposed far-reaching changes to the terms of employment. In order to lend full support to any activities being contemplated to address coronavirus, it would require us to be issued with a plan which clearly reflects our input and which addresses our given consideration to our members' well-being. Wherever we feel strongly about a matter which is not included in a protocol for public officers, we will advise accordingly. Our concerns include the safety and well-being of all public officers, especially health workers and those working at our ports of entry. Consequently, we find it difficult to compromise the following. While we are very much interested and we will do everything to support in every single effort that is being made to control this disease, we are saying that when it comes to the following, we will not compromise. Provision of proper and approved personal protective equipment. Proper usage of personal protective equipment to avoid cross-contamination and risk not only to the public officers themselves, but to members of the public. Fair and reasonable remuneration to be agreed by the union after negotiation. What we find is happening is, even as we speak now, nurses are being approached and certain discussions are being held with them. We believe this is a matter for the union. Adequate psychological assistance to healthcare providers by personnel with whom they are comfortable. We want to re-emphasize that point. An approved budget for the control and management of coronavirus broken down by departments, which would facilitate the purchasing and provision of necessary resources for training and provision of care. Overtime to health personnel required to work outside of normal working hours, attending citizens and screening at ports of entry. Free and open discussion and absence of red tape in implementing the National Plan of Care. Assigning of health workers with pre-morbid conditions in the screening and caring of coronavirus patients. Government's direct negotiation with individual public officers, nurses and other health and supporting staff, and subgroups working with coronavirus patients should cease. Instead, these matters should be negotiated with the union. In the circumstances, the union insists on being treated with respect and as an equal, legally constituted partner. We remain committed to working with the government and all authorized agencies to ensure that our people, and especially public officers, are protected, kept safe, and in good health in the event of an outbreak. In conclusion, I want to re-emphasize the need for an urgent meeting with the Ministry of Health, the Establishment and Personnel Services Department, and other relevant government agencies to address some of the concerns that I have stated. Thank you very much.
I wish to invite Mr. Curtis Augustus of WAU to address us, please.
Thank you. Thank you, Chairman. Let me start with an apology. I'm apologizing for my lateness at this meeting. And this was so because the invitation that I received for this meeting indicated clearly to me that we were meeting at your conference room, Mr. President, Mr. Prime Minister, sorry. When I reached there, I was surprised to see an empty conference room. I inquired, and then I was told that the meeting is now at the parish hall. So I try my best. I do not drive, as you know, or everyone here knows. I try my best to get there as soon as possible. So here am I, and I'm happy to make my contribution. I also want to start by complimenting the organizers of this program, because I believe it is timely. One would probably say that it's a bit late, but others would say better late than never. So we are having this consultation, and again, based on the communication, I expected what I have seen this afternoon, some introduction to some of the plans in relation to what we are going to do in the event that the coronavirus touches our land. I am aware and I believe that that is a responsibility of all of us. And when you are thinking in terms of the labor movement, it is a responsibility for us in organized labor and for the employers' organization whom we deal and treat with on a regular basis. I heard some information this afternoon that is a bit strange, because coming from the DHTA, where, of course, the bottom line is the priority. But I also read a document coming from the ILO, which indicates that anybody that is sick and stays home as a result of the coronavirus should be paid sick leave. So to me, that is not a problem. What I see is that people may be fearful in terms of working in an environment where possibly there may be an incident of somebody being sick from the coronavirus. And if they decide to stay home to work, they should not be disadvantaged, but to be treated as sick leave. So that should not be a problem, because the Employers Federation representative told us about Section 2, subsection 2 of 8901, the Industrial Relations Act. What she quoted was from that area. So from us in the Waterfront and Allied Workers Union, prior to this virus being known worldwide, we knew nothing. And when it was declared early, I started to take note. When it progressed to the pandemic status, I gave greater emphasis in terms of trying to find information relative to the impact that that could have for us in Dominica. And really and truly, the employers and ourselves are supposed to be monitoring this thing. because in all of the 41 or so collective agreements that the Waterfront and Allied Workers Union have, there is an article that speaks to the question of occupational health and safety, where it is the responsibility of the employer to provide safe and healthy working conditions for the workers. So it is for them. And what really I would like to hear from them is what they are doing or what they have done in relation to preparation for this virus when it appears in Dominica. We have had from the union reports and indications from two of the departments that we represent, albeit regional, and I'm speaking to LIAT and to the First Caribbean International Bank. And both have indicated to me the plans that they have. In the case of LIAT, they're going to ensure that the attendants, those who handled the luggage, are going to be provided with masks and gloves. Those in the cabin will be provided with proper, as we heard it this morning, PPEs. So that, we think, is taking a precautionary measure to protect the workers, which I think is the responsibility of a number of workers, a number of employers, sorry, because they have a responsibility to provide that safety workplace. So in the early stages, I had what I considered to be a precautionary workplace preparation for this virus. Among the things I noted was to make sure that the workplace is clean, tidy, and hygienic, and that the workplaces are sanitized on a regular basis, that surfaces like desks and tables and objects like telephone and keyboards to be wiped with disinfectant regularly, to promote and to encourage regular and thorough hand washing with soap. Some of those, we have heard them. Put sanitizing hand rub dispensers in prominent places in our establishments. Promote good respiratory hygiene in workplaces. Ensure that face masks and paper towels and paper tissues are available. And in that regard, they should pre-order sufficient supplies of those, like the tissues and hand sanitizers. We know, and the experience have been, that when you go to the pharmacies, today you cannot get hand sanitizers. All of them sold out. So we have a challenge in that area, and more so for the workers at our banks. I am aware, through negotiations, that we have set aside what we call sick bays, a sick room, in the event that a worker feels unwell. From the First Caribbean International Bank, they put a number of things, including some of those that I've spoken about, hand sanitizers, gloves, to be available to frontline workers. And I have seen in one of the banks that the hand sanitizers are available. So people could sanitize their hands by using the hand sanitizers. That is the consuming public too. We talked about special distance, or the social distance, 3 feet. But that is for persons who probably are coughing on a regular basis. I was in the bank this morning, and that social distance did not apply because of the number of people that were in the line for service. Talk about the pre-order of the protective equipments. So we are happy for that. And in the case of First Caribbean, there is almost a ban on travel. They are going to restrict travel as much as possible during the next 3 or 4 months. So, Chairman, I believe that the employers must engage the union, because some of the things that I've said, I did not get that from any of the local employers. So they must engage us, because we are partners in this thing. It is together that we could ensure that this coronavirus doesn't take root at all in Dominica, and we should put ourselves in a position to stamp it out if it arrives as quickly as possible. Thank you.
Thank you very much, Mr. Augustus. The church representatives, we will start with Nurse Priscilla Prevost, giving us her commitment, giving us her church's commitment.
Yes. In the first discussion, I answered the question as was stated, minimizing attendance. And now, as to what the church has done and is doing or plan to do, first, from the 27th of February, we have been circulating information to all our churches regarding what we know concerning the coronavirus or COVID-19 and what we can do. And we have 13 points on what we call a bulletin that is circulated to all the churches. And I will not go through all of them because most of them everybody have already mentioned. But some things that stands out, we provide the hand sanitizers and, of course, soap liquid as opposed to soap bars at the toilet facilities, upgrade the toilet facilities at some of the churches. We have 32 congregations, and we are asking them to ensure that the toilet facility or washroom facilities are upgraded with dispensers for both tissue paper as well as soap liquid, hand soap liquid. We're also asking that the bins that are in the washroom or anywhere, the bins should be those that you use pedal operation, and that person's hand should not touch the bin when disposing the tissue. We encourage the social distancing, 3 to 6 feet, and also to avoid the handshakes and hugs, which is normally part of the fellowship at church. We should clean and sanitize frequently public rooms, furniture, telephones, handles, and other surfaces with bleach, alcohol, or Lysol. And also anyone with a travel history experiencing fever, cough, or other flu-like symptoms should consult their healthcare provider and avoid congregating until the all clear is given. This advice is to help the healthcare provider to prepare for the individual rather than they just go into the health center or to the hospital. They should call in advance. And of course, the hotline, the COVID hotline for Dominica is also given on this bulletin. This morning, I met with the administration of the conference, which consists of the administrators, treasurer, secretary, and president via Zoom. And this is a media that we are able to do distance conferencing. And this was we had met for 2 hours, 2 to 3 hours, as we discuss our plan moving forward. And one of the activities, we will be having a staff conference again via Zoom both in Barbados staff and Dominica staff, which consists of all the pastors, the principals of our 4 schools here and 2 in Barbados, and also our staff, office staff members, where we will actually discuss the plans as we move forward. The schools, our schools are well on par, on target. They have done training. We have done training with our teachers. Should any event that school be closed, that sessions or classes can be held online. The parents have had meetings with PTAs, and they are also getting towards that. We hope that we doesn't get to that, but should it come to that, our teachers are trained to do Google Classrooms and to ensure that school continues, though not on site, but that they continue having school. In terms of our church services, services will continue. However, we want to encourage, as we said, if persons are sick, that they should not congregate. And we also ask that they take the numbers of their class teachers so that they can, even if they are not at church, they can be contacted and they can receive information and counseling and advice. We will continue to send bulletin. This is bulletin number 1. We will send another bulletin next week with updated information. And also, we encourage persons to follow what we call the New Start principle, where we encourage nutrition, exercise, diet, those things that will help persons to maintain health and well-being, because from what the information we have received, we know that the persons who succumb to the infection are mostly those who are the elderly and those who have comorbidities or other underlying diseases. So while we try to address the coronavirus in preventing and managing, we also need to ensure that we continue to deal with our hypertensive, our diabetics, and those persons with those comorbidities so that they can be properly managed, and also to boost the immune system of the general public. These are some things that we encourage in the membership, so that every week information is given at church services so that our the membership as well as the community who attends are well informed and well prepared even to address the situation whenever and should it come. One last point, it is said that 21 days is required for development of new habits, and therefore, even though we do not have any detected cases or confirmed cases here in Dominica, yet if we practice those things that are being recommended, it means that we'll develop new habits so that should it ever come our shore, we already have the practice and the habit that we will be able to continue. Thank you, and God bless.
Very well articulated, Nurse Prevo. But knowing us as Dominicans, we always like to hear from our leaders. And so the Pastor Randy Rodney is representing the evangelicals, and I'm sure they want to hear him as well, because at this point we are live. It's a live broadcast.
Thank you, Madam Chair. Along with the issues that I raised earlier in terms of what we're doing, going forward, there are some other areas that we intend to look at. We are in constant consultation, for example, with some of our partners in the region, especially in the island nations now where they have confirmed cases of COVID. One of them we will be speaking with by Zoom this afternoon. That's the Grenada Evangelical Alliance, as to what they're doing and what can we do as a region together. One of our aims is to keep providing education continually. As the information is disseminated to us, we provide it to our various communities, because we really feel that every one of us must be responsible for the other person. Understanding that we don't all have the same level of education, We don't have the same level of tolerance. Yet we need to protect the other person if we are to protect ourselves. So that we want to provide education throughout to all the communities. Hence, we again request that as the Ministry of Health would have relevant information that is important to us, that information is passed on to us for onward transmission to our various communities. One of the areas that is very critical for us is psychosocial support. And I have found over the last few weeks that there are parents who are stressed and individuals who get even more stressed because of the news that they hear. And some of it is not what they should be listening to, however they're hearing it. And hence we are providing quite some psychosocial support for people, reminding them that this is a virus. Yes, it's serious, but it's a virus. And you're not just going to die just like that by hearing about it. We're providing biblical support for people to remind them that we do everything physical, but we also lean on the Alpha and the Omega. Just last week, I found out, for example, and we as a church, we took decisions years ago to make sure that we were in line with international standards in terms of our washrooms. But we just found out that our toilet dispensers are not good enough for corona. It must almost be, self-dispensing the towel. And so the availability of that is an issue, at least in our region for now. And we're hoping that we can do that and encourage our churches, for example, to do the same thing. As an association, though, we want to give our commitment that we will encourage our churches and encourage our communities to do that which is necessary to ensure the prevention of people contracting or transmitting the disease. I can't overemphasize, and I've done that before, that this is our business. It's not their business. It's not my business. It's our business. All of us must put our shoulders to the wheel to do it so that we can't sit by and laugh at somebody else's comment or criticize somebody else's thought because they may only be speaking from their personal perspective, which may be wrong. And we need to take the position, and we are taking the position where we try to educate our people in that regard. So we want to provide that commitment to the Ministry of Health, that as an association, we will commit ourselves to doing everything that's necessary. We will continue to pray and believe God. This morning in one of my conferences before international partners, we got a testimony from a pastor from Wuhan in China, whose congregation of 325 were all affected with the COVID virus. And he said he didn't know what to do. He had lost faith. He spoke to one Christian brother who says, call everybody who's affected and pray. Today, they were tested, all 325 people, and they are all cleared. And the Ministry of Health there want to find out how comes they got cleared so quickly. And we believe it's God's intervention. Thank you.
Men of faith. The Catholic Church started practicing, Father Journalist, with no peace, and so you will guide your membership.
And just making sure that the microphone was sanitized before I touched it. In addition, thank you, Madam Chair. In addition to what we have enunciated before, as far as the liturgical practices are concerned, I think we're going to go on into a four-pronged approach: the spiritual, intellectual, and the pastoral. So I'm glad that Pastor Rodney mentioned prayer. Whenever we have the hurricane season, we always have special prayers that the Lord would spare us the ravages of hurricanes. And that is a prayer that we pray in every church every Sunday. We're going to do the same thing for this virus. We have all the scriptural evidence to prove that when the people of God were backed against the wall, they called on their priests, they called on the prophets, and they pleaded with God, and God did something for them. And we say we are a Christian community, a Christian country, so we go to the same thing. Pray and pray again. So every Sunday there will be in the part of the service a prayer for the containment of the virus, for the healing of those who are affected, and of course for those who have died, that they would be at peace. So that's the very first part, the spiritual side. Because we believe that somehow whatever is happening in the world today, the spiritual cannot be removed from it. So that is, we're going to begin with that. And then second, in terms of the human and intellectual education. We have a lot of people who get a lot of information on social media, but we're very aware that we have a lot of elderly people who have no idea of what social media is. And we have other people who are, as I normally say, of a respectable age, like myself and others over 70, who are not really that much involved with social media. So they need information. And we have a lot of good healthcare professionals, both Catholic and otherwise, who I'm sure can be tapped and will be tapped to come and address our congregations, teach us what are the good practices for our own hygiene and what can be done to avoid the further spread of the virus. So intellectually, inviting them to understand what the virus is about and how to deal with it on their own, and recognizing also that it's not only for your own self, but for your families and for the rest of the community that you belong to. In terms of the pastoral approach, again, of course, in terms of education, we have Catholic Radio will be putting some spots on the radio about the virus and so forth, things that people want to hear and understand more about it, how to take care of themselves. But in terms of pastorally, a greater thrust to all age levels. We have people who are in First Communion class, people in the confirmation classes. They too need information about how to deal with this virus and how to protect themselves. And especially, again, for the elderly, that on their home visits that we take care of, because they're the ones who are most at risk. We're told, those who are of a certain age, that they too would be especially attended to. Home visits, not only from the pastors, but also from the rest of the Christian community, that people are would understand that we are our brothers and sisters' keeper. And somehow we need to reach out to those who are in need and attend to their needs as well. So education, spiritual formation. The last thing is the cancellation. Cancellation, from what I mean is that we have several events coming up that would involve large groups of people. We're going to continue to monitor the progress of the virus. And if it's necessary, we will cancel whatever we can that would involve large groups of people to make sure that there's no spreading of the virus. Thank you very much.
Thank you very much. I now invite the Leader of the Opposition, Honorable Lennox Linton, to present. Thank you.
Thank you, Chair. Good afternoon to all participants. Congratulations, and thank you for the wonderful work you've all been doing to the best of your ability from your various stations in life in Dominica. I want to thank the Chair for the invitation to be here this afternoon, and I want to thank him in advance for the invitation to the other members of the parliamentary opposition for the next such gathering of this nature, the next such consultation of this nature. The elected representatives of Salisbury and Roseau North need to be at these functions as well, along with our senators in the parliament. We subscribe to all of the good hygiene and social distancing practices that have been developed and circulated. And we will be in our education programs, outreach with the people across Dominica, highlighting those good hygiene and social distancing practices. But we'll also be encouraging the people of Dominica to pay particular attention to their immune system, because we believe that's the best defense that we have against this virus or any other virus. And of course, Corona may not be the end of it. There may be more coming in the future. But ourselves, we need to take care of ourselves. And at the end of the day, that's what we have to fight with. Governments can do everything they can. Different organizations can do everything they can. At the end of the day, it comes down to us. If we contract it, what happens to us? How do we fight it? And we know that the stronger our immune system is, the better we are. So, yes, we have this relationship with our God where we pray, and that helps. And the good Lord also tells us that He helps those who help themselves. So we have to help ourselves with helping ourselves and helping others. We have to do unto others as we'd have them do unto us. We have to love our neighbors as we love ourselves. You got to go back to basics. We cannot do with this coronavirus any better than being the best human beings we can. If we are the best human beings we can be, the impact of corona will be minimized in Dominica. And being the best human beings that we can be means taking care of ourselves and taking care of other people as well, loving our neighbors as ourselves. And taking advantage of the information that is now available to us. We are lucky. We're lucky. Know why we're lucky? We're sitting here this afternoon at the parish hall talking about coronavirus, the global pandemic, which emerged somewhere in China in December of last year. Over 145,000 people have been affected so far, 125 countries. Dominica is still on the list of countries that have not yet been affected. That makes us lucky. What's that? What's that? Dominica what? Right, but I'm saying Dominica is blessed because it means the longer it waits, the more time we have to prepare. So the question is, how are we preparing? And I was very pleased to hear from the various professionals in the government service, especially in the area of health. And this pandemic has been showing us some things so far. China, over 80,000 persons affected, over 3,000 people dead. The rate there, 3.9%. But in Italy, the rate jumps up to 7.2%. It didn't start in Italy, it started in China. It spread from China to Italy. And China now is reporting fewer cases, fewer new deaths, almost as though this already has begun to come under some sort of control. And we heard from the DIC representative that the manufacturing capability is beginning to come back, and the contribution to the global supply chain in that regard will be significant. Iran, death rate of 4.5% among affected cases. Spain, 2.8%. But South Korea, less than 1%. And Germany, less than 1% as well. And the lesson that emerges from that as we prepare, because it's not here yet, what are the models that we're going to follow? What are the best practices that we're going to bring on board in terms of testing protocols and so on? Because while we plan for the worst, we always hope for the best. What is the worst case scenario we're planning for? We have around 60,000 people in Dominica. God forbid the virus arrives in Dominica, and within a matter of weeks to months, we end up with 25% of the population affected, God forbid, that's 15,000 people. Of those 15,000 people, the numbers we're seeing around the world suggest that 9 to 10% of those will be serious cases. Some of them requiring hospitalization. Do we have the capacity, on top of what we are dealing with right now? These are the hard questions and decisions that have to be made. So then comes a question, Mr. Chair, about the tough decisions. I think China benefited significantly in its management of this matter from the lockdown of Wuhan City in Hubei province. I heard the President of the United States say that they have benefited so far from the early travel bans and restrictions on travel. Because in Dominica, the virus is not going to suddenly emerge. Somebody's going to bring it in. Maybe one of us who travels outside and comes back in, or somebody who travels from somewhere and comes into Dominica. When we talk about border protection, are we timid and are we shy about closing our borders to travel from certain parts of the world as we try to make sure that this stays away from us for as long as possible? And what is the cost benefit we're looking at? If we keep our doors open or our ports open to the cruise industry for the next couple of months of the year, the cruise year, what is the benefit of that, as opposed to the benefit of locking it down now and watching the next couple of months making sure we're safe? I don't gainsay the fact, Chair, that we have some tough decisions to make, but I'm sure we'll make them, and we'll get there together. I hear your concern about the one voice on critical matters like keeping the borders open to the world and so on. But we'll have one voice when we discuss and we agree. So expect that we will say some things from time to time, not because we don't want what is best for Dominica, but because we believe in our hearts that what we are advocating is the best possible way forward. That is why I feel, Chair, that the Parliament needs to get involved in this. We need to have a bipartisan committee of the Parliament at work on this COVID-19 pandemic, providing guidance, providing budgetary support, providing the assistance, and to making sure that we have the resources dedicated to whatever we need to put in place to get ourselves ready for this, to get ourselves prepared at the very highest level to ensure minimal impact as possible of this virus. That's where we are in our thinking. That's the commitment that we bring to the table, and I'm pleased to share it this afternoon. Thank you. God bless you.
Thank you. Thank you, everyone. I must say that I am heartened by the tone and tenor of what's emanating from this room today and this consultation which we've been having. I got the feeling that for once, there is one Dominica. What I've heard here today is that Dominica and Dominicans are ready as one to grapple with COVID-19. That being said, I think we have to make a few things clear. Firstly, we are all Dominicans. We each will be called upon to go beyond the call of duty and beyond written tenets. of any working agreement or contract. The persons we will be treating shall be, in many instances, be our brothers and sisters, cousins, and even our very own selves. They may also be visitors to Dominica who are bringing much needed foreign exchange into our country. What we need now, I will say to all of us in this country, are not battles, but national cooperation. If this virus impacts and gets out of control, there will be no revenue in the country, and there will be no country. My sincere advice to Mr. Later in particular is be careful you do not, in your own excitement, overdo. This is a national crisis. A national crisis that demands a national response. Nonetheless, I will say that government is mindful of your stated concerns and will take note with a view to addressing and resolving in the period ahead. And I wish to make clear that Dominica is a country of limited resources. Limited resources. Dominica's traditional friends are also impacted by the coronavirus. Dominica will have to grapple with COVID-19, or Dominica will sink under COVID-19. We were supposed to have been in Japan in the month of February, for example, give me a classic example, to witness the signing of a contract to repair both the Marigot and Rosa fisheries complexes to the tune of over 10 million United States dollars. And this has been set aside because our officers are unable to travel to Japan. And of course, for the threats to their own safety, health-wise. I want to make it clear that I understand the stated concerns of the trade unions. But I wish to share a secret with my brothers. This virus was not planned. 4 months ago, there was no COVID-19. Today, there is not a single supermarket in the whole of Florida with a single ounce of hand sanitizer. Shelves are empty with no toilet paper in the state of Florida. This challenge that we face is not the sole responsibility of any single entity. We are in this together as a people and as a nation. If we are speaking about securing job conditions, I would like us to consider that with no economic activity, there will be no businesses. Therefore, there will be no jobs to go to. If the Miami port, for example, closes, there will be no ships coming in to bring food and other supplies. What I am saying here is that we need to seize this youth and eye outlook to this very urgent and critical matter. Small islands like Dominica are under serious threats. And we must recognize that we are all in this together, my dear brothers and sisters. The Unionists have very strong points, and they need to defend those points, but not in this arena. Not today. Not against this threat of human life to human life. We are speaking here of the protection and preservation of lives. That's what we're talking about here as our first action. Reality is, all of the supplies we are talking about now could be exhausted in a few days. What happens if the ship does not come next week? We are Dominicans. We have to be resilient. We have to be innovative. We have to set out to solve problems. And we also have to appreciate that this is an evolving system. Every day you have to give consideration to new decision making. And our consultation, this consultation is not an event, it is a process. Because it will require us to come back ever so often to reflect, to review, to reconsider, to consider, to be informed, to inform of issues relating to COVID-19. And people who know me know that I am not afraid of taking decisions, even when they're not popular. Because first and foremost on my mind as the leader of this country is the protection of and preservation of lives of our citizens. But I believe that we cannot overreact or even overact too early. And so we have to continue monitoring, and I can say to you, we are in touch with PAHO on a daily basis. On a daily basis. We each have, as citizens, to take the precautionary measures. Follow the protocols recommended by the Ministry of Health. Because at the end of the day, our best defense is an informed population. A population that's prepared to exercise and to make use of that information given to it. And so, my dear brothers and sisters, this is a time for us to hold each other's hands tightly as we walk through this extraordinarily difficult circumstance. And we as a nation will spare no efforts in seeking to prepare ourselves. No efforts whatsoever. This is why even today the Cabinet has decided to appoint an overall national coordinator of our country's response. And I want to say that this person has graciously accepted to serve in that capacity, and this is Mrs. Jennifer Astafan, who will serve as our national coordinator. And we have also called out Dr. Colin McIntyre, who will serve as the national coordinator of logistics to ensure that that which we say we have to put in place at the airports in respect to the isolation rooms, that those things are done. So when the minister says we should do this, or the cabinet says we should do that, that it has to get done and get done in a quick fashion, because time is of the essence in our preparation. We also intend to expand the membership of the task force, the national task force which we currently have, to include a number of stakeholders. The private sector, the unions, the parliament, the churches, so that we get live information from the task force, and armed with that live information, we are better able now to go into the communities among our constituents to share that information, to educate our people on what we need to do together to ensure that we can deal with this challenge. Now, as we all recognize is happening in the world, you can do all of what you need to do. You can do all of what the WHO has said to you. We can do all of what POW has said to you, and we have been doing that within our own constraints. It will not prevent it from coming to Dominica. And so, our point of action is to plan and to ensure that the plan that we have in place is robust, and we have the resources, human or otherwise, to get this going. And on this issue of resources, I want to express, as I did at the NIPO meeting, my sincere and profound gratitude to the public servants who have been at the front line of this, in its preparation, and the many nurses who have come forward to say, I want to volunteer. I want to volunteer to provide this extraordinary care in this exceptional circumstance to our citizens. And the customs officers, the port workers, the medical doctors, the environmental health officer who is the first point of contact with the airplanes, the ground handlers, the agents of the airports and the ports and the ferries. All of these stakeholders are critical to our national response. And how fortunate are we to have people, notwithstanding the threat or the challenge to themselves personally, are showing this sign of extraordinary commitment and dedication to their duties and commitment to our country. And that is what we would like to see permeating the whole of our society. Because this virus knows no social strata. It respects no race. It respects no religion. As we see, unfortunately, like all other citizens, the wife of the Prime Minister of Canada tested positive for this. The Vice Minister of Health in Iran, the Minister for Health of the United Kingdom, notable leaders who are charged with the responsibility of charting their country's responses have been subjected to this. So I am grateful to all of you here for your presence. We are not setting aside your comments. We have taken note of all of the comments that have been made. What we have said in some instances, that there are some things we can deal with otherwise. But this opportunity is for us as national leaders in our own right to say to all our citizens and those whom we represent that we're in this together. We're in this together. And I believe we have successfully been able to send that message to Dominica and the world, that in the Commonwealth of Dominica and the sovereign republic for which it stands, that we are united in this fight against COVID virus. And I believe that will help us manage misinformation out there. That would help us guide in a very structured and responsible manner national discourse. Because we have to manage the confusion that's out there in terms of information, what is accurate information, what is misinformation. And we all have a responsibility to so do. And so I leave this meeting coming here with great expectation. I can tell you I am leaving here satisfied that my expectation was realized, and that as the national leader of this country, it gives us an opportunity to continue the engagement and to focus our resources and our efforts at continuing to plan for this country. And whatever decisions I'm advised to take on this matter, we shall take them. Once these decisions are appropriate for the time and circumstance. So as the days go by, as the weeks go by, there'll be a need to review and to reflect on additional decisions which need to be taken. So I note some of the recommendations in respect to travel, in respect to schools, etc., etc. But as time goes by, the same case as we heard from the Football Association, that they're assessing the situation, but for now, they will maintain things as is, and to further review. That's how we operate into. That's how we operate into. But I want to say to our citizens that this is not a time for us to be paralyzed by anxieties. And we must never take decisions based on fear. Our decisions must be clear-headed decisions. Decisions that we have been able to clearly think of and distill and finalize. But I'm saying to the country, while the loss of revenue and loss of economic opportunities are extremely important, especially to our country, our preoccupation is about the health and safety of our citizens. And so if the point comes down the road that we have to quarantine the whole of Dominica, then that decision shall be made. If it says that we have to stop this and that from coming in and leaving, then those decisions will be made. But all I'm saying is that we have to keep monitoring and assessing the situation and be advised on it from the scientific standpoint, and then as we go along, those decisions will be considered. And on the final point, which the leader of the opposition mentioned about the wider parliamentary grouping, there will be a presentation made to the whole of the parliament. And I accept and take note of the suggestion, for example, of setting up a bipartisan arrangement. And you know me, where bipartisanship is concerned, and I think it's a matter for us, if we give a commitment to it, it can certainly work. And so I am all for this. I would like to call on the Minister for Health, who has been at the forefront of the leadership of our preparation. And who certainly has been managing our anxieties nationally. I wish to invite the Minister of Health to say a few words and to thank you on behalf of all of us here today. Dr. McIntyre, please.
Okay, pleasant good afternoon to everyone gathered here. Protocol has been established, so I'm going to just move ahead. What we've been doing in the Ministry of Health is that we have a plan, and it's really not a plan based on sentiments or anything like that. It's purely scientific and it's purely factual. And our evidence and all the facts come from PAHO, from WHO, and these are the authorities that the information is what we're using that we can put our plan in place. So there are 4 scenarios. Scenario 1 is there are no cases. Scenario 2, you have 1 or more cases. Scenario 3, you have clusters of cases. And scenario 4, you have widespread community spread, outbreak. So since we're in scenario 1, we're following the protocols for scenario 1. You cannot be in scenario 1 and you're following protocol for scenario 4. It doesn't work that way. There's a science to everything. So we're in scenario 1 where we do not have a case. So these are the protocols that we are following presently. So the protocols for scenario 1, obviously the first part is to activate the emergency plan. That is the International Health Regulation, that is the NIPO. We had a meeting recently and you saw those ones. Then the second part of that is the risk communication, where we deal with the press briefing and the press conferences, etc., and we let the public know what's happening. The third part for scenario 1 is the case finding, the contact tracing, and the management. That's where we come to the protocols. So the protocols are those that we're following for the cruise ships and the ferry, etc. So for instance, we did meet the ferry people, and we asked them to fill out, every passenger coming on the ferry must fill out a form. That form must come to our port health officer, and they must fill out the Maritime Declaration of Health, which must reach us within an hour before the ship arrives. So all these protocols have been followed by the ferry, and we're very grateful for that. Apart from that, the cruise line industry, they have to fill out the Maritime Declaration of Health at least 12 to 24 hours before. If there's any change, then they have to do it at least 4 hours before the ship reaches our port. All these measures have been in place, and all of these have been adhered to both by the cruise line and the ferry. So these are the protocols that we have put in place, and these are working, and these are the ones that are recommended by the WHO, recommended by PAHO, and recommended by CAFA as well. And we're sticking to those, and so far they have worked pretty well for us. In the event that there's a suspect case, we have also protocols that we face. In the event that it's a probable case, we also have those protocols. In the event that it comes from a hotspot area, we know exactly what those protocols are, and these are the ones that we are following. So everything is scientifically based, and everything is based on the evidence that we get from PAHO, from WHO, and CAFA. Then we come to the section, this other section is 4. That's all part of scenario 1. And in 4, that deals with the surveillance, and that also deals with testing. But then we have the NPHRST, which is the National Public Health Response Surveillance Team. This is nothing new. This was set up in 2007. And whenever there's an event like this, all we do is just reactivate it. So it's nothing new, this committee. We just reactivate it and we do what we're supposed to do, because these events are going to come anyway. Sometimes, well, we've had Zika in the past, we've had Ebola, we've had all those different incidents. And all we do is just reactivate that committee, and then we can follow the exact plans that the WHO and PAHO have set up for us to manage such conditions. Then the 5th part of it is the public health awareness, where we have the health promotion, which tells you about hand hygiene and respiratory etiquette, how you sneeze, how you cough, how we clean the rooms, etc., etc. And our health promotion unit has been doing an excellent job. As a matter of fact, the video you saw at the end of Dr. Johnson's presentation, This has come to me from so many parts of all over the world. That just shows you how fast it spreads, and other people from other worlds are saying to us, and it's just an excellent job that we'll be doing, bringing the message across to everybody. And then, as some people did mention, that not everyone has access to social media and the TV, etc. So we have all these radio messages that you'll be hearing on the radio that's been going out. So that is the part for the scenario 1. If at all we happen to have a case, then we switch gear. We come to scenario 2. That is why we have to appreciate the fact that this is a very fluid situation. You don't just have a hard and fixed response to what's happening. If you come to scenario 2, then obviously the response changes. Then we're talking about limiting attendance at events, we're talking about closing schools, we're talking about our e-learning, etc. But we haven't reached that stage. We're in stage 1, scenario 1, and that is what we're sticking to. If at all, God forbid, we get to the other stage, then we switch gear, and we go into a different gear. And if we go to the third stage, then we keep switching gears. So that is why it's a very fluid situation. We are monitoring it, and we're in contact with, as a matter of fact, I had a very long discussion with the representative for Power for Barbados and the OEC yesterday, explain our exact plans that I'm telling you here today, and he was pretty much comfortable with what we're doing. So it's not like we're just doing things vai-ki-vai. No, we know what is happening, we have the information, and we're following the protocols that have been set for us by the international agencies. Having said all of this, we have to appreciate the fact that, well, this consultation today is an excellent intervention. I think it's timely, and it's a very excellent intervention. It serves to bring the information to the general public, and that everybody should know what's happening. As a matter of fact, with knowledge, knowledge is power, and ignorance is the greatest poverty. So if we can continue that way, and we can bring the information across that the entire public and everybody knows what's happening, I think that's a better way to fight it than being divisive. And I think this afternoon we expressed a high level of togetherness, and that's really what we need to do. We have to realize we come together as Dominicans. This is a common threat that we face. This is a common defense that we're going to put up so we can handle this. And all the stakeholders are on board. And if we can just stay together, have a comprehensive, combined response, that's what it's all about. That's where we're going to get results and benefits. Obviously, there will be the little fake news coming here and there. Let's not spread them. You get some little negative stuff, you don't have to pass it on. Let's just pass on all the positive stuff. Let's just stay focused. We get some good stuff about hand hygiene, respiratory etiquette. These are the things we're going to spread. These are the things you send on your social media. But the negative parts, let's try to leave them out. We don't want the entire public to be all panicked and anxious, and anxiety spreads. That doesn't help the cause at all. We have to stay focused, we have to stay positive, and let's give out all the good information that we can possibly give. The Ministry of Health is available, so whether it's the private sector, anyone, the church communications groups, anyone who wants more information, you can contact us at the Ministry of Health. We are willing to give advice. We also, the Football Association mentioned they're going to monitor the situation regarding their tours. We're also monitoring lots of events going on, the government events, whether we're going to cancel, whether we're going to continue. So as I said, and I keep saying, it's a fluid situation. We have to monitor it day by day, and then we make decisions based on the evidence and what's happening. But all in all, I think this is just an excellent opportunity for us to come together at Dominicans and fight this common thing. Granted it's an adversity, we didn't ask for it, but it's here. But we can change this adversity into an opportunity. And this is the opportunity that is presenting to us, that we can make a difference, we can come together, and we can fight this COVID. And we have to appreciate the fact that it's not business as usual. This is just not business as usual. A few months ago, we never knew about this, but here we are. So we cannot treat it as business as usual. It is an emergency. It's something that we have to be very proactive about. And I think the Ministry of Health and our staff, I must commend them. They've done an excellent job. And we have our health promotion unit running from event to event, and they're going all over the place, whether it's the schools, whether it's the private sector. And we just have to join and just do it together. Whether it's the health promotion, all over different stakeholders, fire and ambulance, I don't want to mention too many because I might just leave out one, and do not want to leave out anyone, but all the stakeholders, you know yourselves. And I think we've done an excellent job trying to fight together. Granted, we may not be perfect, And as time goes along, we keep tweeting our reactions, our actions, so that we can get something as clear and near to perfect as possible. But that is the whole thing. I think we just have to stay together and stay focused. Let's give the good information out there. And if we can do that together, I think we can definitely fight it. But I must tell you, yes, we are following the protocols. We have this in mind. And our staff of the Ministry of Health, we are fully aware of the sacrifice that they will be making since they are the first line of action, together the fire and ambulance. And that is why we've made sure that we give them adequate training, and we keep letting them know what the message is out there, and we let them know what the different challenges are. So that's why training goes on at all these different areas where we have our staff and the first line of action people. Let alone that, in terms of the protective, the PPEs and the personal protective equipment, we're making sure that they have those because we have to protect them. They are the first line. And we are aware of the sacrifice that they're making. So obviously we're discussing also that incentives must be there. So if incentives have to be there, it'll have to be there. I mean, it's a sacrifice people are making, so we have to recognize and appreciate those sacrifices being made. So I just want to let you know that yes, we are taking decisions purely based on the information we get from the international committee and all the international agencies. It's scientifically based, and as time goes along, if we have to tweak and if we have to adjust, we will adjust. But at the moment, this is what WHO recommends, this is what Power recommends, and this is what we are doing. Thank you very much.
We have to continue to practice. Now, I want to put a little lighter side to it. We've been here from 2:30, and it is now 6:30. But think of it this way. If Corona arrives, we'll be communicating by phone, by WhatsApp. You just think of it, by email. So we would not be spending so much time together. And this afternoon, we should look at it as, a real good opportunity that we can sit here. There are countries where you're on lockdown and all of this, and you're not able to sit, all in the same place and look at the smiling faces. So let us consider it a privilege to be here, and that is why we're here so long, discussing a very important subject. I would like to ask you to wait just a little moment, because we want to share with you an NBC documentary just before you leave. So just have a little patience with us and enjoy each other's company. Remember, as we leave, while he's setting up, remember we are practicing. And if you observe when you came in, you got your hand sanitizer. We've been sanitizing. We had all of these posters that we put up. This is all part of preparation for the public gatherings. And as we leave, we have to remember, you know how we like to hug? You know the reason we like to hug. We like, a real hug as we leave. I know we like to hug, but let us get accustomed to the bumps, the elbow bumps as we leave, and so on, leave the hugs, because we have to practice. It takes 21 days. That's what we were just to. We have to practice for if it happens. The documentary now.
Joseph Fair, a virologist and epidemiologist who's worked on the front lines of the Ebola outbreak in Africa, believes facts may be our best defense against the coronavirus.
There's so much misinformation out there, and it's breeding a lot of confusion. Let me ask you this. Is COVID-19, as you call it, is it in the air? If I take a deep breath, did I potentially take a deep breath of the virus?
Especially not outside. We're sitting in front of nature's greatest disinfectant, which is sunlight. The UV light inactivates the virus.
So around all these people, I'm relatively safe.
Absolutely. You need to come into direct contact with it, either by someone coughing or sneezing and those droplets landing on your face, your eyes, nose, or mouth, or you've touched a surface and then you yourself touch your face, nose, eyes, or mouth.
You're telling me that everything up here is the point of how the infection gets into my body?
It's a natural instinct. Everybody touches their face, probably up to 50 to 100 times per day without even realizing that you're touching your face. It's going to happen. That doesn't necessarily mean you're going to get coronavirus. If you're sticking to that rigid hand washing protocol, if you're using tissues and barriers, etc., you're going to be able to scratch your face, obviously, and not infect yourself every time you do so.
And with that in mind, we set out to explore how to best protect ourselves from the virus.
So public transit makes a lot of people nervous. I mean, this car is going to move. Usually there's not a seat.
Usually in close proximity.
And you're going to hold
Again, I'll hold it with a tissue. If I don't have a tissue with me, I'll usually do an arm hold like this. Yeah, just to keep my skin from contacting it.
But, you know, this idea of being 6 feet away from people, that's not going to happen on a typical bus or train.
Right, and that's why it's up to the individual. You know, you've got to cover your mouth when you cough or sneeze with your sleeve, ideally. We know just from studies from San Francisco's metro that a lot of antibacterial resistant pathogens, et cetera, last on these surfaces for a very long time.
He doesn't recommend masks except for sick individuals or trained medical workers.
And, you know, I have a desire to put on a mask right now because there's so many people around us.
Yeah. The only way we recommend really mask, because there's only a specific type of mask that will protect you against the virus itself, and we should tend to reserve those for healthcare workers. Also, if you're not using it with goggles, it's not really going to protect you because you've only blocked two of the 3 known routes of transmission. If you are sick and you're coughing, it is a good idea to maybe use a surgical mask yourself as a sick person. That way, when you do cough, if you're not covering, you've at least got a physical barrier between you and those droplets that would come out when you cough or sneeze.
Next, we headed to the office.
I think it's probably fair to say millions of Americans work in environments not unlike this, sitting, you know, 6, 7 feet apart. What should we be conscious of?
Mostly your own personal hygiene and being careful when you sneeze, et cetera, on others. So obviously wiping down your desk and disinfecting your desk several times per day is a good idea to keep your own self healthy. There's going to be the occasional chance that you sneeze, and that is going to happen. Sneezing and coughing and during cold and flu season is very normal. So ideally, you'll have tissue or some hand sanitizer next to you. You'll be able to reach quickly, grab a tissue, use it to cover your mouth when you cough or sneeze. Immediately dispose of that tissue.
Don't put it on the desk.
Don't put it on the desk. And then hopefully sanitize your hands or go wash your hands would be even better.
And routinely disinfect your personal workspace, he says.
Everything here would be what we call a fomite, or a surface that can carry an infectious virus for up to 9 days in the case of coronaviruses.
So I sneeze, I wipe my nose, I pick up the phone, it's there.
Yes, absolutely. Because this is really one of the filthiest areas, and including that cell phone in that, it's really one of your dirtiest areas. So I wipe down everything, all the keys, etc. Take my phone, wipe it down.
And the most powerful tool to fight coronavirus is soap.
Every surface here is some of your more dirtier areas that you can find anywhere in the world. So everybody that's just used the restroom, coming here, this would be an infectious surface, this would be an infectious surface,
But
this would be an infectious surface.
I need the soap.
Absolutely. So our most powerful tool against fighting COVID-19 as well as any other infectious disease in general, get our soap. Ideally, you'll have hot and cold water, make it a little warm. And I usually try to emphasize that, just a few seconds is not going to do the job. You don't need to do a surgeon's hand wash, but you need to do it pretty thoroughly.
Is it the water, the soap, the friction? What is
Soaps have a lot of detergents in them that automatically...
We would like to thank you for your participation this afternoon. And we want to thank in particular all the presenters and the persons who supported the organization of this event. As we leave, let us always say, I know we pray for ourselves, but let us always say a prayer, a special prayer for the healthcare workers and all the frontline staff within the public service as well as the private sector. I wish you all the best, and let us continue to pray that God will continue to spare us from this deadly virus. Thank you very much.